So the areas that I want to kind of go over are really within urinary tract infection, kind of talking about different components of it. Really, why is it an issue? And then kind of dig a little bit deeper into the understanding of what are some of the potential pathological risk factors. When kind of think about it, just to stir your mind of why within this population of neurogenic lower urinary tract dysfunction, patients who have Parkinson's, multiple sclerosis, spinal cord injury, other issues that could do it. We'll then go to how do we go through and diagnose it, then hopefully put some information that's needed of how can we potentially treat it or prevent it would be kind of the aspect that I'd like to get to. In my world that I've seen, and hopefully you've seen it here, urinary tract infections are clearly the number one issue that's been going on within urology. Just even able-bodied patients, not only neurologically impaired patients, but able-bodied come into the office for that area. And for patients who actually have disabilities, the fact that they have issues of infections, whether they can be lower urinary tract or upper urinary tract, has significant impact. Think about it. If all of us are traveling here within this conference, none of us want to get sick. None of us want to have sort of ill feeling that we can't come and enjoy. But this is an issue specifically for our neurologically impaired patients. It always is on their mind. It's always something that's there. And if you think about it, even though the advances we made within science, within medicines and everything else, 10 to 15% of our patients are still having sepsis, and that is terrible. I've actually had, sepsis is still the number one reason that some of these patients with spinal cord pass away due to some other factors that go along with it. Our issues that you'll see is that we don't have really good areas of our communication. Our ability to say what is and what is not a urinary tract infection is different. And we kind of have this discussion. There are some polling questions that we put through during this talk. Some people have already answered them, so feel free if you have answered those, we'll come to those in a little bit. In the United States, we have roughly 330 million Americans. And if you look at the prevalence, probably within spinal cord injury itself, spinal cord injury, the upper prevalence is roughly around 330,000 Americans have spinal cord injury. You couple that to other non-traumatic ones and up to about 4,000 or 400,000. And if you're in the hospital, you're brand new spinal cord injury, 31% of the time you will have issues of urinary tract infections. And that, once again, is whether it's upper urinary tract or lower urinary tract. And on average, at least in the United States, what we're seeing is 2.5 times a year, but that range can be upwards to 10 times per year, depending on the patient. So knowing that fact that if you have a neurological condition, you're going to have nearly 3 urinary tract infections a year, and you just don't know when that's going to hit. And you hope that it doesn't tend to recur. The article that you're seeing here was an article that was put out of emergency room visits. This was between the years 2006 to 2011, and they recorded all patients with neurological disease coming into ERs. And if you can see there, I know it's kind of small, but basically they had 875,000 patients come into our emergency departments. And of those 875,000 patients with neurological disease, urinary tract infection was the number one. 92.8% of the time UTI. And of those patients that came to the ER, 1/3 of the time they went home, but 2/3 of the time it required hospitalization. The cost to our system has been astronomical. We have got to do a better job. And there's no way that the ERs can quickly diagnose a urinary tract infection in a neurologically impaired patient who's got Foley catheter or suprapubic tube. They don't have that ability, so the tendency is, well, let's just put them in observation, let's treat them, and let's move along. So urologists have sort of looked through and said, what are kind of the factors? What are the underlying factors in this sort of population that really could potentially lead to urinary tract infections? Let's kind of dig down into the science, the underneath of that area. And this was an article, review article that was done in 2014, and they kind of broke it up into 3 main areas for this condition. Basically, the patients have altered intrinsic defense mechanisms that are abnormal. They have impaired washout, ability to cleanse the bladder area. And there's also issues specifically with catheterization. So those are the 3 main buckets. And what I want to do is we're going to kind of go through some of these areas, just some of it's for thinking about it. There's no definite answers here, but you kind of have to understand, is this population kind of at risk and why? And the hope with understanding this is that maybe that'll spur sort of research into these areas. So if you think just on altered intrinsic defense mechanisms, if you look at the perineum, specifically within the female perineum, we normally have protective mechanisms there. You have a lot of lactobacillus, you have a lot of streptococcus, and staph. That's the normal perineum. And those are the front lines preventing sort of E. coli and other bacteria to come through to the urethra. However, within the spinal cord population, their perineums are different. They have a lot altered bacteria there. They have the Enterobacteriaceae, Pseudomonas, the Enterococcus. They sit there, and it's been known that whatever is around the perineum has a high likelihood that it's getting within the bladder. So one of the key things is optimizing vaginal health within our patients who have disabilities that are on intermittent catheterization is kind of key. The other component to it is understanding the dynamics of what the urothelium does. The urothelium, during the maturation process, as it moves from the basement membrane to the mature area, the urothelial cells develop, and they're called umbrella cells. And typically, the umbrella cells have a natural component to it that when a bacteria attaches on to the umbrella cell, it basically will apoptose. It basically sloughs off. And that's a natural defense mechanism. And what we've been looking at within the spinal cord population is they can determine the developmental degree of those urothelial cells. And they do that by looking at cytokeratin 20, and they also look at it for uroplakin. And these are markers of developmental processing for the umbrella cells. And as you can see here, 83% of the spinal cord injury patients don't have cytokeratin 20, and spina bifida patients actually lack a majority of times the uroplakin. And consequently, the theory is potentially they have a developmental process going on, or they're having constant inflammation. Another component to here is really the layering of the lining on the urothelium. Now, most everyone here has heard lectures regarding interstitial cystitis, painful bladder syndrome. You realize the effect of glycosaminoglycans, the hydrophilic layer that kind of is coating on top of the urothelium. This acts as a shock absorber, a barrier for the bacteria to kind of get through, to kind of prevent them from attaching onto the umbrella cells in urothelium. And the issues that we have within patients who have chronic catheters, whether they're doing intermittent catheterization, suprapubic tubes, bladder stretch, there's a lot of potential damage within that gag layer. And we know that within the able-bodied population, putting in gag layer has actually been beneficial.